Thanks, Robert. I'm in.
Thank you, Janine. Great to see you guys. We'll be starting shortly.
Okay.
Yay.
Yay.
Okay, good evening, everyone. Welcome to the North Richland MAC meeting. I'm Robert Rogers. I will be helping to be the administrator. I think we'll give a couple more minutes to get a quorum of MAC members and our chair, Don Gilmore. I expect him to be here as well. So thanks everybody for being here, and let's sit tight for just a few moments. Well, good evening again. I see our chair, Don Gilmore, is here. Hi, Don. How are you?
I'm good. How you doing, Robert?
Oh, real well. It's good to see you again. It's been a long time.
Yeah, it has been a while. Wow. Do we have a quorum already? Let's see. 1, 2.
I do not know. Please take it away.
Let's see. What do we got here? See Annie. Blah, blah, blah. Let's see.
I see Jorge's here. Annie, you. I know that Dulce said she's not going to be able to make it this evening.
Well, you know what? Let's go ahead and we can get started. But we can't do any approvals or actions right now, but we can at least get things going. So I'm not really calling the order till we have a quorum.
Okay,
And so we can go for public comments. I believe that's the first artist. So if anybody has and has any comments, I see Cordell's hand. Go ahead.
Yeah. So can you hear me okay?
Yep, we hear you.
Good. So good evening, Chair Gilmore, board members. I am Cordell Handler, and I have some fantastic news for you all. So you are cordially invited to attend the Richmond Rotary Club weekly meeting on March the 3rd at 12:30 at the Richmond Country Club, and it's $25. So our featured speaker is going to be the executive director, who will be talking to us about GRIP and what kind of services that they provide. And that's the only announcement. Hopefully I get to see you all in person next month. That's it.
Thank you so much. All right. And any other public comments? Go
I
ahead.
see Eleanor, Don.
Okay, let's go. Okay, Eleanor, go ahead. Having a hard time hearing you, Eleanor. We still, do you have your mute button on, or we having a hard time hearing you? A little better. It's we can't hear you. I don't know if you have do you have an earpiece or something, or do you have a?
No.
I'm sorry, Eleanor. I will let you talk again once we get corrected, but we can't hear you. Okay.
And if I may, it may help. It may be a connection issue, Don. If she turns off her video, her audio may come through.
Well, let's try that. Turn off your video and let's see if the audio comes through. Okay, we'll wait till you come back. Okay, Annie, I think you had your hand up. And you, there you go.
No, Chairman Gilmore, I was just letting you know, Eleanor, you was keep going. I
Oh,
want
okay,
you know, Miss Eleanor had something she wanted to say.
okay. Is there any more public comment? Okay. Seeing
Well,
none.
I do have one. I'm sorry. I do have one.
Okay.
And I would like to, I don't know, I just came on, but I would like to welcome Robert back temporary. Okay, so I just wanted to say that. And also, one other announcement, I see our director, David, he's here from the wastewater. So he's waving. So now I'm going to be quiet and we're going to continue on. Okay, so I just want to acknowledge those two. Thank you.
Thank you, Annie. And we do welcome familiar faces. And thank you, Robert, for pitching in for Tanya. And we wish Tanya well. And we're going to continue, as you normally do, work really well with us. And so we look forward to it. Okay, so we're going to go directly to presentations. And wait a minute, let me back up. Let's see, let's go with the reports from the sheriff, and then we'll go down the line there. So someone from the sheriff department.
Hi, good evening, Lieutenant Rodriguez here with the Sheriff Office. I'll start off with the select crime trends. So you're seeing a trend downward. For the month of November, we had 15 select crimes. For the month of December was 15. In the month of January, we had 11. Biggest decrease there was no crimes against persons, at least in the form of assault with deadly weapons. And then also a decrease in property crime. So for the month of January, we generated 387 calls for service, which resulted in 49 reports. Some of the recent activities, we recently appointed a new resident deputy to the litigation spot. That is Deputy Aaron Sakai. He's doing a great job. He's hit the ground running. He's been getting a lot of help. Thank you, Janine, and also Victor, as well as the folks from environmental health and public works sitting down, giving us some edification as far as the position for him. Prior to moving into the mitigation spot, he was assigned to that beat as far as North Richmond primarily. He's also one of our training officers, so he's doing a great job. And so far, he's actually already solved a couple cases. In a couple incidences, the responsible parties actually agreed to clean up their mess, and the incident was documented as well. So far it's been good. It's working out pretty good. Deputy Sakai, along with Deputy Cruz and Deputy Webb, who are other resident deputies, also recently participated in a walk with community members as well as members from Supervisor Dory's office. That seems to have been very beneficial. We got some great insight from the community, as well as it allowed the deputies to share some of their experiences, and also some information regarding potentially getting cameras to assist with illegal dumping. And then the main focus there is getting more street lights and illumination in the community. So that was very helpful. We also recently participated in the monthly kind of teacher association at Verde Elementary, where we provided some training as far as active shooter, what to expect if we get a call of an active shooter, or if we just get any sort of call with, hey, there's a report that a student has a weapon on school grounds, or if there's a police, some sort of law enforcement activity taking place off campus that's going to result in a lockdown of the school. So specifically with Verde, just due to its location and kind of the restricted access, it's primarily one way in, one way out, short of having to open up different emergency access gates. So that was actually that seemed to be a really good event. We got some good information from the parents that we'd like to see, as well as sharing our plan and the school sharing their safety plan. So pretty beneficial. We also have a creek walk coming up next week, or actually forgive me, that was this week with Supervisor Joy's office. So we'll be looking at some ways to address some issues taking place in the street, primarily illegal dumping as well as some of the mechanics that are popping up over there. So that's all I have at this time. Any questions for me?
Any questions?
I have a comment,
Okay,
Chairman Gilmore.
go right ahead.
Okay, thank you for that report, Chef Rodriguez, but at the last end, it was kind of muffled, so I don't know if anybody else had a problem hearing it, but I did. But I would just like to make a comment that it have been brought to my attention that on Sunday mornings, services that has taken place in the unincorporated area at Davis Chapel, there has been a continuous parking issue in the red on the corner of Chesley and Truman. And it's a hazard, coming out, in the morning from service around 11:30, that you have to come all the way out halfway, a car link into the street in order to either make a left turn or a right turn. By that time, the oncoming cars or traffic can hit the front of your car. So I was just wondering, I know we've been asking for for our CHP to be a part of the MAC. They used to be years ago, but is there anything that we can do or you all can do to come through on Sunday mornings in order to enforce, to have that part of the corner of Truman and Chesley to be tagged because they're parked in the red and you cannot see when you're coming out. So it's just, right now, it's just waiting to happen to have another collision there. This is why we had the traffic to come out before and to take a look at that. That's why it is marked red. So again, I just want to bring that to your attention. And so I can get that back to the members of the church because it is a concern. And I just wanted to just bring that to your attention. Thank you.
Thank you for sharing that. I was not aware that that was an issue. I will relay that to our weekend day shift. We also have Lieutenant Carlton on the meeting with us tonight with CHP, so he may have some other recommendations for us. But I'll pass it on to weekend day shift and see if we can do some enforcement. I'll hate to see somebody get hurt.
Okay, thank you.
Any other questions for the Sheriff's Department?
Cynthia, I have a question.
Yeah.
What Annie was saying, like I mentioned before in previous MAC meetings, that I have that problem just about anywhere I go in North Richmond. I come down and go to church on Sundays, but on my way leaving the freeway and getting to church, the streets of North Richmond, the cars are hugging the corners and you have to like drive out in the middle of the intersection just to make sure it's safe for you to go. And that's throughout the entire North Richmond.
Thank you, Cynthia. That is something that we are trying to address. There are a couple locations within the community to where we've been addressing parking issues, mostly just to the number of cars that they have at the residence. And in some cases, they can be towed from the roadway. Others, we're having to tag them with a 72-hour notice. And if they comply with the notice and they move them lawfully, it's a temporary fix because eventually they'll be back parked in the same spot. So we'll continue to work for those residents, but we are aware and I appreciate it.
And if I may, Sheriff Rodriguez, I just want to reiterate that it is marked red and it is a constant. So this isn't something that, we can look at like, it is marked red and it's been marked red for over 6 months now. And it's there, it was clear for a little bit and now it's back to being parked like, oh, well, I'm going to park here. So I just want to bring that up. Okay. All right. Thank you.
Thank you. Any other questions? I see none. And I see Highway Patrol is here. And so I will turn it over to Highway Patrol.
Hi, good evening. Can you guys hear me okay?
Yes.
Great. Well, my name is Tyler Carlton. I'm a lieutenant here in the Oakland area office. I'm actually new to the area, just transferred in about a month ago from Sacramento. I'm sitting in for Captain Kevin White right now. He wanted to be with you guys, but he's on vacation right now. So as was mentioned earlier in the meeting, we once enjoyed a partnership with you guys through our COPS program, and that ceased, I believe, in 2021. We certainly want to continue that relationship, and we're committed to do that once our staffing levels permit us to. This staffing issue is not unique to the Oakland area, but it's one that's important to the Highway Patrol, and we're focusing on trying to strengthen recruitment efforts across the state. We've currently got 10 officers that are on break-in right now in our area. And if successful, they will be removed from break-in and be on their own officers in May of this year. So our fingers are crossed for that. We've got 2 officers that are graduating the academy in February and reporting to the Oakland area. They'll then go on to break in and then hopefully join our rank and file that's out patrolling the streets on their own. In the interim, the Oakland management team is committed to attending these meetings and hearing your guys' concerns. And I've already taken note on a couple of these things. With the staffing shortage that we have right now, that's not just felt locally within your community, but also on our main thoroughfares on the freeways. So we need to be careful where we balance our enforcement efforts and services, but we certainly want to hear what your guys' concerns are and direct enforcement efforts where we can and service where we can. I think one of the things that we can do in the interim until staffing permits us to assign an officer dedicated to unincorporated areas such as yours is attending these meetings, hearing your concerns, and then disseminating that information to our rank and file during our shift briefings and encouraging patrols and drive-throughs in your community.
Thank you for letting us know where the CHP stands now. And we know that a number of agencies have access to the office on Fred Jackson Way. And if their intention is to keep working through there, we would welcome that. And if we're looking at May as a target for that, that would be great. Any questions? The other question I have, I don't see any hands, but one of the things that's happening is that there are cars that are parked on the street and that are not, their tags aren't current. The cars are in bad situations. I've seen them particularly in the area right by where the office is on Fred Jackson Way in the 1500 block. But who patrols that? And I'm glad Mark is still around. Maybe they can talk too. Maybe there's a coordinated effort. But who actually tags those cars?
So currently we do as well. We have a community service officer. That's one of his primary functions. February on Blow. And then also just our deputies on patrol. One of the things that I've asked our staff to do and that I've noticed, especially in the early morning hours. So normally after about 10 o'clock and before 6 o'clock, I'm starting to see that there's a lot more vehicles that are being double parked on the roadway as well. And in addition to the expired registration, but you can imagine that creates a huge safety risk for us. Just getting the normal flow of traffic and then going around and going along the way on the roadway and causing a traffic collision, and or we're trying to get down there with emergency vehicles or fire truck and now we're not able to get past because of something like that. So it's our staff that does it. CHP obviously has the ability to do as well, as Lieutenant Carlton mentioned. with staffing, you know, it's that balance of where's the biggest need right now in terms of that. So I can ask our staff to increase that. I know I've asked them previously to increase it with the parking that relates to the street sweeping and the set times and dates for that. To also help with mitigation in the watershed project. So I'll ask you to increase the efforts. Hopefully they'll have an impact.
Yeah, so it was a little hard to hear you, but I think the gist of it is that you're going to increase that activity in the area based on a lot of different circumstances that need the attention. I know that one of the things is street sweeping. Usually folks are getting notice or whatever, and that hasn't happened before either. I mean, it hasn't happened in a while either. So we welcome the increased activity around that. And I don't want to hog the show. Anybody else have any questions for either Mr. Carlton or Mr. Rodriguez? I don't see any hands. Okay. Thank you so much. Is anyone from Richmond PD available? I don't see anyone here. And Robert, I'm not sure if you can check in on that to see what's going on with that part of with the city of Richmond.
Absolutely. Who was coming from Richmond PD most recently?
Well, we have to look back at our minutes. Cynthia, do you have that information? But we could get that information to you.
It's okay. I could look it up myself. No worries. And we'll try to get our PD to come to the next meeting. Thank you.
Appreciate it. Okay, so we're gonna move on. And I think we have a quorum, so let's go back up to the top. And hopefully folks have took a look at the agenda and the minutes. And if that's the case, I could entertain a motion for those approvals for the agenda and approval of the minutes.
I have taken a look at the notes in the minutes, in the agenda, and I motion to approve the minute notes from last meeting and to approve the agenda for tonight.
I second that.
Okay, it's been moved and properly second. All in favor, I know you by saying aye.
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 Opposed? Abstentions. Motion stands and is approved. All right, so we're going to move all the way back down here to presentations. And the first presentation we have is from the North Richmond Health Clinic.
Hi there. This is Dr. Gabriella Sullivan. I'm the medical director for Contra Costa Regional Medical Center and all the clinics. And I have a presentation for you. Did you want to share the one I sent, or shall I share my screen?
Please share your screen.
Okay. Let's see. I don't know if I'm allowed to share.
Unless Robert has another suggestion.
Dr. Sullivan, do you see share screen at the bottom of your screen? Is it enabled?
No. It says whiteboards, reactions, captions. Oh, share screen. I'm sorry. Here we go. Okay.
Thank you.
Great. Okay. Slideshow. Okay. All right. Are you guys, everybody able to see that?
Yes.
Okay.
If you can maximize your screen, that'd be great.
Yeah. How do I do that?
The top right box next to the X.
There we go. Play. Okay. Excellent. All right. So this is it's got about 30 slides, and so which is definitely over the 15 minutes, but I'm going to breeze through a few of them. So no fear, I'll keep it to 15 minutes. So here's a picture of the outside of North Richmond Health Center. We have, this clinic has family practice, lab services, pediatrics, HIV, women's health, prenatal, social workers, and integrated behavioral health workers as well to do short-term therapy and to liaison into psychiatry. And I hope you're able to see the hours of operation and all that. I just can't tell if I'm sharing properly. Okay. All right.
It's visible.
Okay, great.
Yep.
The health center, just a quick little bit about it, opened in 1999, but it was created as a response to the 1993 General Chemical Sulfuric Acid release. And the community advocated for a health center in their neighborhood and specifically requested primary care, mental health, dental care, and substance abuse. And we have almost 8,000 patients impaneled at the North Richmond Center for Health. North Richmond, or the zip code of 94801, has about 3% of the Contra Costa population, just so you know. So we have about 7,000 of the 33,000 patients, residents of 94801. The median income is lower than the rest of Contra Costa County by this much. This is all from census data and also other websites that have to do with health. And it was compiled by our business intelligence data analysts. Here is some income breakdown by household, families, and you can take a look at this if you like to get a better sense, but there's a difference in between 94801 and the rest of Contra Costa County for general income. By race, there's also differences, and you can take a look at that information there. Income by race compared to the rest of Contra Costa County. And education, you can see that. So there's some, these are just comparison slides to what the rest of the county looks like. So the clinic that we have there, and also 94801 these days is primarily Latinx, used to be primarily African-American, but those are, so it's, Latino and African-American primarily, with a number of other races also represented. It tends to skew a little bit on the younger side. So you can see that the majority of the patients are, in their 20s, 30s, and 40s, 50s, with some differences. And I'm saying, some obviously kids and older people as well, but tends to skew a little bit on the younger side. And more or less equally distributed, but slightly more males than females in our clinic. Languages, we have dozens of languages. I mean, the extent of the diversity in languages is quite astonishing. I myself not heard of some of these languages, but we are able to do translation for all of these languages through our health center and our translation services. So pretty spectacular. Folks had really wanted to hear about STD information, so that's why I'm presenting this here. When I was asked to do a presentation, this was one of the things they particularly highlighted. So that's why we're talking about it. And also asthma, which will come after this. So this comes from public health records, and you can see that steadily for gonorrhea, the numbers have been going up over time, over the years. And in fact, the total for Contra Costa County in 4 years is, 9,670. But for the residents of 94801, it's 561. So that's 5.8% of the county total. I'll do a summary slide after all these, but you'll see a trend that is concerning. And here's a breakdown by race, ethnicity, and age as well. Not too surprisingly, younger folks are affected here. And well, the majority of patients are Latinx or African Americans, so they're represented as well here. This is for early syphilis, a concerning thing that's come to the light, in the last few years that used to not be active, and there's been an increased activity, pretty much nationwide. I don't know about the world, but definitely nationwide, and certainly in the Bay Area. So it's not unique to Contra Costa County, nor to the zip code 94801. But you can see there's the total for Contra Costa County, the total for residents in North Richmond, and so that's 6.3% of the county total. And again, breakdown by race and age. Chlamydia has, pretty pervasive sexually transmitted infection with 28,000 cases and 1,400 in North Richmond, 5.4% of the total. And HIV, thankfully, has not been increasing too much over the last few years. And of course, there's fantastic treatment available now. But the total cases in the last 4 years are those. And then in North Richmond, these are the cases, 31, and that's 6.3% of the county total. So the analysis basically is showing that, as you can see, that North Richmond 94801 has 2.9% of the Contra Costa County population, but gonorrhea rates are, 5.8, chlamydia 5.4, HIV 6.3, and early syphilis 6.3. So overall STD rates are up to double the rates in the rest of the county. Well, I could go on to talk about asthma here in a second, but I wanted you to know that this is in the purview of the public health department. We're the delivery system. We do the clinics and the doctors and the patients, but for things like sexually transmitted infections, those do go through public health for, categorizing them and also initiatives for treating those. And there are some exciting new initiatives that I didn't add to the slide because I didn't know about them at the time, but that public health has come up with. And I sent this to the clinics, both West County and North Richmond, and I certainly can send it to you guys, their presentation, but there are some exciting initiatives that they have. Like you can get at-home HIV tests. Also, there will be, if people are concerned they have an STI, they can have a person come to their home to check them for an STI. And these are available to all residents of Contra Costa County. But you must be 17 years or older, and it's by appointment, but it's from 8 to 7 p.m. So it's called Home is Where the Swab is, or something like that, the initiative. So it's kind of meeting you at home to take care of possible STI. So that's one of the exciting initiatives. And of course, there's various other programs, including home HIV tests. But again, I can pass along a lot of this information to you that I've collected since I looked at this analysis. Okay, so moving on to asthma. This is a long-standing problem in the area. These are hospital discharges and emergency room visits. And you can see that The background rate, so this is just for hospital discharges. The rate is 8.2 per 10,000 patients. Or is it percent? Let me think here. I think it's, yeah, it's 8.2, the case rate. It's the case rate. So it's 8.2 per 10,000 patients. And then the background rate for Contra Costa County is 4.2. So already that's double the Contra Costa County rate for hospital discharges. And as you may know, asthma disproportionately affects, you know, young children by and large, or they're most affected by it. So that's clearly seen here as well. These are ED visits. So you can see that the rate for 94801 is 112 per 10,000 case rate. The background for Contra Costa County is 44. So that's 3 times or close to 3 times the rate for emergency room visits in the area. And again, disproportionate percent of children affected. So as a summary, asthma hospitalizations are double the background rate, and ED visits are 3 times that, and the age group with the most profound rates are in the 0 to 4 age range. Just a few slides about things that's sort of some bad news for the area, but we do have some good news, which is we have focused very much on various quality improvement projects for health. So and you can see these are the rates for North Richmond, and we've done very well in these areas. So breast cancer screening, chlamydia, eye exams, HIV care, A1C, which is for diabetes. So a number of things we've done well and better than our targets. And these are other things that we've done very well in. You know, you can see them: imaging, influenza, postpartum, prenatal care, etc. These are areas that need work. So asthma medication ratio, this is the fact that asthma patients need to have a controlled inhaler, not just a rescue inhaler. So it's a ratio between having the controlled and the rescue inhaler. So we send out too many rescues and not enough control. This is a problem kind of associated with pharmacies that dispense those too. Anyway, it's a complicated problem. But advanced care planning, we do need improvement in well child visits for both adolescent and children, and particularly in the African-American population. We do have an incentive program that we're starting up, calling folks to come in to get a well child visit and give them a Target gift card for coming in. So we are so keen to have people bring their kids in for these well child visits where they can get all their immunizations and stuff, that we're starting this incentive program there. So you can see there's some areas that do need more improvement. I think that's it. Yep. So happy to answer any questions. I know that was a lot, and hopefully anybody can access this slide deck who would like to look at the material more in depth. And I do have some material from public health regarding programs that they've like I mentioned, for STI testing and asthma programs as well. So thank you. Happy to answer questions.
Jorge, and then I got Cynthia. Go ahead.
Hi, Dr. Sullivan. Thank you for the info. I just want to double check. I think I missed it, but so this info comes out every 4 years, all this data?
No, it comes out every year. It's lagged. The lag time is at least a year, though. Sometimes you can see that it only went up to 2020, some of the data. So
Yeah.
that means that there's a big lag time between getting all the cases recorded, tabulating them. That's sort of a public health issue. But it is recorded yearly, and it just takes a while for it to show up on the data sets.
Makes sense. Okay, thank you.
Sure.
Thank you for confirming.
Go ahead, Cynthia.
Okay, thank you for your presentation, Doctor. I would like to say, well, first of all, we're so used to having Chenier, director of the North Richmond Center for Health, report to us. And I would be curious to see what she has to report, because it's been a while since she's given a presentation to the MAC. But what I'm interested in is that on the onset of the COVID, we had people from the health department come out and give us North Richmond statistics on about COVID and how it was affecting North Richmond. We never did get a follow-up on that. And Dr. Clark, he's dead and gone, but he was really had me pursuing, trying to contact people within the health department to have them come back to the North Richmond MAC and give us statistics on the results of COVID in North Richmond. And I thought you would include that in your report.
Thank you for your comment. I will take that back to our public health folks who have that data. I was asked to sort of talk about these couple of things, and I only had 15 minutes. So that's what I focused on, but I'm sure we would be happy to come back anytime to do that COVID presentation for you.
Thank you. Latifa.
Hey there, thank you for your presentation. I'm happy to, I was wondering what types of services were provided there, and I actually came by one day just to find out, but it was during lunchtime. So I wanted to find out what type of community engagement do you have, and also how do people find out about your services, and do you have like a mobile, you mentioned wanting to do like well checks for children. So do you have something that's mobile that, or do you have like any type of community events where people can just come up to your mobile facility to get services?
Yeah, great question. We don't have, I mean, let me say, public health, the Division of Public Health has mobile vans, and they have school-based clinics. So there are a number of clinics, like Kennedy High has a clinic. I'm not sure what other, maybe Richmond High. Anyway, there are definitely a couple of clinics embedded in high schools, and they have mobile dental vans, but they don't have pediatric mobile vans per se, just for that reason. But we are very accessible to the North Richmond population. So we do have conductors and navigators that are available to help people. Like if you don't have Medi-Cal and you'd like to enroll in Medi-Cal and be seen at our health center, we have people who can help enroll you and get you going. Unfortunately, we do require Medi-Cal. There are some clinics that don't require insurance, or they have a sliding scale, but we do require the Medi-Cal product or Medicare to be seen. But so we're really want to be very accessible to, and by the way, anybody from the community, no matter if you're a patient there or not, you can come in and get a COVID test and a COVID vaccine. That goes without saying. So anyone can walk off the street for that. And that's always been the case. But there's, we have limited capacity to do outreach more than that in the community, other than try to keep the doors open as much as possible. But public health has greater capacity to do that. So I can, work with them and explore with them what that would look like. But part of what I was hearing was that the community wanted to know what were the issues the health issues that were facing the people in the area. And that's kind of why I focused on what we're doing well and what we need help with, and then, asthma and STI rates. So I would say, we need help getting families in with their kids to do well child visits. We need those cervical pap smears done. And we gotta, improve the STI and asthma rates. So I would say those are top things to work on for the community in terms of health.
This is Chenier on the line. Hi, Dr. Sullivan.
Hi, Chenier.
Thank you for your presentation. So, Latifa, did you have any questions that you wanted more detailed information specific to North Richmond Clinic?
No, I just wanted to, not really. I guess the follow-up would be about the asthma, the controlled medicine. It seems as though, is there a shortage? Is that what I heard today?
It's not a shortage. There's been a lot of work we've done over the years, whether it be grants or ongoing education to our patient population to make sure they have a medical home. So a lot of patients, instead of coming and entering care, they have a problem and they go to the ER. So we want to make sure people have a medical home, they have a primary care that's addressing all of their medical needs, but also that they understand that, as Dr. Sullivan said, you want control meds that are you taking daily to control your asthma. And then if there's an event that's an emergent event, then you use your emergency inhaler. But you shouldn't be using an emergency inhaler to control your asthma, and you shouldn't be using emergency room to get your medical care. Right? You should use that in the event of an emergency, but we want you to have a medical home with your own primary care doctor where you're receiving your ongoing primary care. Does that make sense?
We got a lot of questions lined up, so I'm gonna go to
Thank you.
Beverly. Go ahead. Are you there, Beverly?
Yes, I am. I had a question. You have the material. Is it available in a digital format, or is it available at the clinic? How do we get copies of the materials that you have?
Sure. I sent it to Tanya Pulido, who I think is with the Board of Supervisors. But if you give me an email for someone here, I'd be happy to send it to that person to distribute.
Robert, you can just send it out to the group if you have it. We'll just email it to folks.
Yes, Dr. Sullivan, please send it to me. Thank you.
Robert, what's your email?
I'll put it in the chat right now.
Okay,
Thank you, Dr. Sullivan.
thanks.
That I had the mobile that comes to you. Do you have to have Medi-Cal for that mobile to come to you for home testing, swab at home?
No.
And
No,
so
you do not.
if in the information that you sent, that is part of that information packet?
It is not in the presentation that I gave you, but I'm going to send you also that information. It's a separate little slide deck. It's only got 5 slides on it, and it describes the home swabbing. And I think this is amazing. And I mean, there's one particular, you can't see it, but there's one particular flyer that has the phone number that you call and when it's available and so on. And anybody could, copy this flyer and post it, for example, in any church or community center or something, just so folks are aware of this. But I will send this to Robert to distribute to you guys.
Thank you so much.
Sure.
Okay, we're gonna move to Bertha.
Hi, Dr. Sullivan. This is Bertha. I'm a neighbor here in Richmond. And I just, out of curiosity, I would like to know what is the purpose of giving this data about the asthma and the other, I don't know how called, but that's one question. And the other one is, I know that many folks in this community that they don't have insurance and they also cannot be eligible for medical. These people can come and get a doctor appointment and pay in out of pocket.
Yeah, so Berta, the clinic unfortunately cannot take folks that don't have Medi-Cal, but Lifelong is a clinic not affiliated with Contra Costa Health Center. I mean, health services, but of course, Lifelong is a wonderful clinic, and they do have sliding scale, and you can pay out of pocket there. But like I said, if you need help with doing Medi-Cal forms, and by the way, they can be very hard to fill out, we do have people available who can help you in our clinic fill those out. And as far as why I talked about asthma, because it's just you can see it's a health problem that disproportionately affects the residents of North Richmond area. So as compared to the rest of Contra Costa County. So it's important to realize what are some environmental things and things that are specific to the area that are problematic for health.
Okay, thank you.
Okay, I'm gonna go to Annie.
Thank you, Chairman Gilmore, and thank you, Dr. Sullivan. I just have a comment, and as far as the comment that I have that I would like to address to you and probably Shanir, if Shanir is still on. As far as the data that was taken, and as you had mentioned, is, as we see, it was 2020. But as far as all the information, as far as the clients that actually attend the health center, is it not so that individuals from surrounding areas, this is not just North Richmond that is being hosted at the Center for Health? One of the things I kept hearing that is North Richmond, but that clinic is open to the surrounding areas. And so the data that you have taken, it's not just North Richmond, but the data is the combination of individuals that has participated in the clinic, coming to the clinic. So that's that comment. And the other thing is that I was looking at the boundaries for not just 94801, that parts of Richmond, 94802 has also been a part of participating at the Center for Health. So I just wanted to, to mention that at this point and to have that kind of clarified so people just won't think all this is just North Richmond, because the hosting of the Center for Health is the surrounding areas, which has been dedicated to North Richmond, but not to turn anyone around that has the wherewithal to participate and to use those services. Okay, thank you.
Thank you, Annie. Well said. And some of the statistics for asthma or sexually transmitted infections are for just that zip code 94801. So it could be anyone living in that zip code X, they could be Kaiser members, they could be Lifelong members, they could be Sutter, that's for just the zip code. But you're absolutely right that at North Richmond, we have folks living in different places and not just in North Richmond. And yeah, we love to serve anyone who wants to be seen there. It is, as many of you know, like a family there. There's only 5 providers. It's very small, but very, with Shanir there, who's been there since the beginning of the clinic. I mean, it is really one of the clinics we're especially proud of in our entire system, because it does provide such good care with such a small family atmosphere. So thank you.
I have one question to ask about just in general. I know there's sub-census tracts that gets more concentrated in the immediate North Richmond area. Be interested to see what if you can deaggravate that somewhat, because I know Point Richmond is included in 94801 area code as well. And the other thing I would like to see, if I know you're limited and you can't do a lot of things that, you know, like Lifelong can do and whatever, but is there any way that we could look at trying to a few things, maybe partner a little bit with some of those folks in regard to the media area that we know we can't provide, but we can work together to get it to the community? And if not, I mean, if so, what would we need to do that? And then the other area would be is how can we help support you to do the outreach into the community, to let them know what's available to them? Because I think a lot of folks, you know, this is a lot of new information to us, and we want to, you know, it was built here in North Richmond to really impact the residents here, and we want to make sure that they're getting the full flavor of that. And so, and I know you have a limited budget, but what we can do to partner with you to, you know, make a greater impact in the community.
Yes, I will. I'm going to connect some of us here to the public health director, who is kind of overseeing a lot of the outreach work. And in a way, in the clinic, we're so busy seeing patients every day and in the exam rooms that we aren't out there. You know, public health department has folks that can go out there and kind of walk the beat or go and really do much better community outreach than, you know. So I will we're all part of Contra Costa Health Services. So I will certainly get together with the medical director there and see what we can do to really improve outreach and connect with partners such as yourself to do that. In terms of partnering with Lifelong, we already do have lots of partnerships with them. I mean, we both provide the same complement of services. It's just that they do have the ability to see uninsured. And that's the main difference. But in terms of clinical services, we are, you know, very similar, but they do have this nice capacity to see uninsured and sliding scale. So
yeah, that was the reason I brought it up, because I saw that was something that maybe might have been missing.
Yeah. But thank you. You'll hear more from me. I'll connect with a few of you and definitely send you guys all my slide decks.
Now I do see some of the same hands up, but they haven't been lowered. I'm not sure if folks want to speak again. I'm not sure if Dante Angel had spoken.
Yeah, I'm not a representative for the Contra Costa Health Services, but I am familiar with their work because of Healthy Richmond's connections, and there are adult ambassadors that are part of like the equity team, and I can drop in the information in the chat related to their manager, who can, you know, connect you with ambassadors that can help either people connect to not only just like health insurance related programs like Medi-Cal and stuff, but also like navigate, you know, if they need certain food banks and blah, 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 like all those other holistic services, like I can put their contact in there. And then also currently they're doing pop-up clinics and mobile clinics, and it's very specific to COVID. And then also right now our organization is doing an outreach and education plan related to CARES, which is a healthcare program for undocumented adults ages 27 through 49 that are low income in our county. And the providers for that are the community health centers, but the health plan is the county. So that's a very specific program for those that are uninsured, ineligible for like Medi-Cal or other programs. So I can drop that info in the chat too. And also there's 14 CBO organizations throughout the county that are helping out related to that. And although our focus is outreach on CARES, some of our CBO, community health advocates and promotores are connecting folks to other programs just so that they can find a place to, find that medical home and navigate the health services. So I can drop that in the chat. Hopefully that helps. So yeah, just wanted to point that out.
Yeah, I really think that we need a real targeted collaborative, basically, to make sure that we get a range of services and that is exposed to the community that of those opportunities that are there. So I don't know, Robert, we might think about who will be the right folks to help, lead that in connection with the center and whoever else is already working on it. We don't need to reinvent the wheel, but maybe we need to get everybody together and target what we want to do. So.
Understood. Yes.
All right. Thank you so much for your presentation. And Shanir, did you have anything else you want to add?
Just, I just wanted to reiterate what Dr. Sullivan was speaking about in terms of our QIP data. We have done a lot of really intensive work around equity. Specifically, we're targeting diabetes, hypertension, especially among our African American and Latino population, well child visits, Pap smears, so cervical cancer prevention, mammograms for breast cancer prevention, and FIT testing, colon cancer screening. And so we've been really doing a lot of creative things to bring our population in to make sure that they are receiving those kind of screenings and follow-up care. And it's so important, we've been talking for years about chronic disease and it's the battle continues, it's just been really challenging. And of course, when COVID happened, so much of our focus was on COVID, and because people were not coming in the same way for their primary care. So Dr. Sullivan mentioned, for example, well child visits. So many children, weren't going to school. Normally they get their physicals. So just really trying to pull patients and families back in to make sure that those children are receiving their well child visits, their immunizations. So there's a lot of work doing outreach and education and creative scheduling to try to make it as easy for patients as possible.
Well, I want to thank you, Shanir, for the work you've done there, and you've been a great asset to the community. We want to look to help support the efforts that you're doing and just make that center just impactful as it can be. So thank you, and Dr. Sullivan, for the presentation.
Thank you very much.
Okay, we're going to move on to the Los Deltas presentation, and I will turn it over to them.
Hey, everybody. My name's Hannah. I'm the fellow from Partnership for the Brave Future that's been working with the Housing Authority on the Los Deltas disposition. I'm also here with Tony, so he can help me answer any questions. I'm going to put some links. So feel free to follow along the slides there, but I'll also share my screen. All right, can you all see my screen? Perfect. So I wanted to just back up. I came last month and presented a similar presentation, but there were some questions and I just wanted to clarify. So I wanted to back up and start by saying that the Housing Authority is not a developer. The Housing Authority owns the Los Deltas land and is selling portions of it to developers. And while the Housing Authority does manage and own a bunch of homes, they don't develop them. So this process is selling it to developers, which are a person or company who oversees all the people involved in building homes, who would convert the vacant land that the Housing Authority owns right now into homes or other businesses. So this is the Los Deltas public housing site land, the former Los Deltas public housing site. So you can see it's all over North Richmond. A big chunk of it was on the main campus over there in the pink. That has all been demolished. So it's about 11.5 acres of empty land. And then there are the scattered sites in blue all throughout the community. So that's all the land that the Housing Authority is going to be selling, and they're going to do it in 3 steps. The first step is a below market value sale. So essentially, the housing authority is giving away, selling for $1, 16 of those blue buildings. And those will be sold only to nonprofit housing developers. And I'll go into more details on the next slide, but there's going to be a request for qualifications. Developers will submit proposals to the housing authority, and a selection panel will choose who gets those first 16 buildings. The remainder of the blue buildings will be sold at market value. So there's about 52 of those, and I'll get into more of that. And then the main campus in the pink over there, that will be sold last, sometime next year, most likely, but it will be after all of the blue sites are already sold. So I wanted to just break down some components of what an RFQ is. Again, it stands for Request for Qualifications. So we're just looking for qualified nonprofit housing developers to buy these $1 homes so that they can turn them into something meaningful for the community. That's why they're being sold for $1, because we really want to make sure it's something that serves North Richmond. So in the RFQ, we're going to have the sale objectives and the goals, and we've really tried to be as responsive to the community as possible. So we've been meeting with a bunch of different community groups, getting everyone's desires written into there, and it had been determined that homeownership was a big priority in North Richmond. So that's why we decided that these 16 sites for $1 are going to be converted to affordable homeownership. Also in the RFQ is the site location, the history, the current conditions of all of the buildings, the zoning and the land use, basically everything that someone who's going to be buying that land would need to know in order to develop it. And then it's a request, right? So it's requesting a financing plan, a rehabilitation plan, community engagement plan, and affirmative marketing plan. So all of that will come from the developers, and then it will be scored through a selection process. So there are selection criteria on each of those plans. You know, how well does it represent the goals of the community? Does the financing plan make sense? All of the different plans will be scored by a selection panel. I do want to clarify though that just because it's listed as a goal in the RFQ doesn't mean that all of the ideas will necessarily happen. They will all be scored, so we will do our best to choose the developers that are as responsive to the stuff we put in the RFQ as possible, but it's really up to the developers to come up with those ideas. And so the housing authority can't necessarily guarantee that all of the goals will be responded to. So here's some more details. Again, I put the link in the chat, so I know I'm going through this really fast, but feel free to look at it there. The RFQ for these $1 sales will be released very soon. We've been working really hard on getting that out and just trying to make sure we don't rush it too much to make sure everything's settled up, but we're putting it out as soon as possible. And our goal is that the 501c3, which is just a nonprofit, the nonprofit developers will be chosen around May. So that will give them about 90 days between the time that we release the RFQ and the time that they have to pull together their proposals and turn it in. Once they turn it in, the selection panel will look over all the proposals and do the scoring process. That selection panel consists of government staff, so there'll be someone from the housing authority, there'll be someone from the county planning department, there will be some housing experts, there's also going to be someone from Supervisor Joya's office, and then there's going to be 3 North Richmond resident leaders. So we have been working to locate those leaders. I put out the link to that in the last few MAC meetings, and when we release the date for the RFQ, we'll also release the names of who is on the selection panel. So that should be in the next few weeks. I also want to clarify that the Housing Authority really works under the direction of HUD, which stands for the Department of Housing and Urban Development. That's a federal government agency. and they have to approve of everything that happens. So it's not only up to us. A lot of what we're working with is federal rules. But assuming HUD approves of the sale, the developers that get the sites for $1 will then have site control. They will own the land and they will be able to build on it. And part of the RFQ says that they should be trying to build the homes within 2 years. So that means around mid-2025, the homes would be ready for people like you all to potentially buy them. Again, they're going to be affordable homeownership opportunities. And by affordable, it means that anyone who makes more than this income is not eligible to buy those homes. This is the absolute maximum income. We're hoping that it would be affordable to people who make below these incomes. So if you're a family size of 1 and you make under $74,000, you would be eligible to buy one of the homes. If you're a family of
these-
4,
And
Okay.
Hannah, I just want to jump in real quick, sorry. And these numbers will change every year. The income limits change. So we'll be adjusting those. Essentially, they're 80% of the area median income. So whenever the time comes, whatever that number is, that's what's going to be the threshold.
Yeah, thanks. Yeah, they change every year. These are from 2022. So it will actually be the 2025 numbers. And with inflation and everything, it could be very different. But I wanted to provide you an example of what 80% in area median income means, since I know it's not that clear when we always say 80% AMI. We also have a local preference policy for these buildings. That means that they first will be offered to anyone who used to live at Los Deltas, because when Los Deltas closed, all those families had to move. So we want to give them the first chance to move back if they choose. If there's homes left over after that, then they would be made available to North Richmond residents, both current residents and also people who maybe used to live in North Richmond but had to move because the rent was too high or anything like that. If there are still buildings left over, then they could be open to the general public. But again, they'd still have to be making below this 80% AMI number in order to buy the building. So that was the $1 sales. There's 16 of those. The rest of the buildings, there's 52 more, is going to be sold at market value. And that's so the Housing Authority can recuperate some of their lost funds from having these buildings vacant for so long. This will essentially work like any home sale. There will be a realtor, the homes will be listed, and people can make offers and they can be negotiated. The homes will be sold as is. So if there's a lot of damage in a lot of the homes, there's fire damage, some flood damage, they really need a lot of work. So these homes will be sold as is. And because of that, we expect that there might be more developers who would want to rehab them and fix them up for people who don't have the skills to do that themselves. But anybody can make an offer on these. It's likely to happen by the end of this year, so probably in the fall. There won't be any income limits assigned by the Housing Authority, and there's no time limit like there is on the other ones where we said you have to build it within 2 years. This will just be sold to whoever buys it, and they can do with it what they please. There's also no requirement that it's used for homeownership or housing, although that would be a preference. If a developer does buy these homes, they might assign their own income limits, and say that they want it to be below 80% AMI, but that's really up to whoever buys the property. And then the main campus, we will come back to the MAC once we have more details on this, but essentially there'll be an even longer, more extensive version of the RFQ called an RFP, request for proposals, and another similar selection panel of people. It'll just be a lot bigger and more complex, but the idea is pretty similar to those first 16 sites where developers will submit proposals for what they want to build, and that will be scored. It's really a blank slate, so there could be rental housing, affordable home ownership, a mix of both. We're thinking that it's likely that there will be some commercial uses or other amenities on the site. So I know there's a lot of interest in a community center or park, museum, grocery store. Any of that could be proposed by developers to make it kind of its own community here in North Richmond. And because it's such a big project that has so many different pieces of it, it's likely to take a while to get it approved. Well, first proposed, then approved, and then built. So that could take 5 or more years from now. So a longer timeline for sure. So here's just a summary of the timeline. We will release the first RFQ by March. That's our goal, hopefully this month, but we'll see. Then developers will have 90 days to submit their proposals. And in that time, we will be working with the selection panel to train them on what they need to know before the scoring process. Around May, the Housing Authority selection panel will select the developers for those 16 sites. And then we'll be working the remainder of the year on making the plan for the market rate sales, trying to make that as fair as possible, and also on the main campus RFQ. So I'm sure we'll be back at the MAC several times as we come up with those plans and take more public comment on them and everything. As far as for you all as individuals, these are what we expect and when we expect will be available for you. Most of those 16 scattered sites are duplexes, so there should be 28 or more affordable rehabbed homeownership units available for purchase by 2 years from now, so summer 2025. The market rate units will be available this fall, but again, those need significant rehab, so only people who have the skills and resources in order to fix them up and make them livable should really consider purchasing those. If developers purchase them, then we would expect them to be available another year or two after that, after they can rehab them. And then the main campus units, which could be home ownership or rentals, plus a new portion of the community like the museum or grocery store, whatever the developer decides to put on the lot, that would be available and ready to be used by the public between 5 and 7 years from now. So here's just our contact information for me and Tony. And then also I put this link in the chat already, but if you want to be alerted to when each of these processes are starting, if you subscribe to the newsletter here, we'll send you that information. And you can also ask us questions at any time or go to the website that I put in the chat that has, that I update every couple months as we come up with more ideas. So that's all.
Thanks, Hannah. That was really, really helpful. Just to kind of clarify though, 5 to 7 years is not a long time to do the main campus. So for example, and Don can talk about this too, I think it took 8 years just to get Heritage Point to a place where, it was good to go. And this is significantly more land. It's going to be a lot more units. So I hope people aren't all getting excited about having units in 2 years down the road. The schedule is going to fluctuate with, the availability of materials and, funding and, staff to actually do these things. So, we're all working to make this happen. We all want to see it happen quickly. The longer it's vacant, again, it brings people dumping materials in the streets. It just, squatters, all kinds of problems. So we really want to deal with the issue quickly. And the way to deal with that is to get people out there building, getting those units online so that we have families living there. If there's any questions, we can answer those today.
Okay, open for questions. Latifah, are you getting ready to speak? No, okay.
Yeah, I still wanted to just reiterate the with the market rate units. I'm hoping that there will be an allowance for local purchase as opposed to and individuals as opposed to corporations and long distance owners. And then the other thing is, I know in the quality of life plan we said for the campus that we wanted it to be a mix of homeownership and rentals. My understanding is that when the people were displaced from these units, then the homeownership for North Richmond went up. So I think we still want to have a nice mix of homeownership and rentals as opposed to just rentals when it comes to the campus. So I just wanted to make that comment. Thank you.
Yeah, no,
Okay,
I think that's the plan. You know, we'll see what developers submit as proposals.
Okay, we'll go with Eleanor, then Annie. I see your hand after that. Yeah, but we'll see how it goes.
I would like.
Hey, Ms. Thompson, I don't know if you can type into the chat, so maybe
Yeah.
you can type it in, the question, and we can answer it.
Yeah,
Yeah.
we can't hear you. It's breaking up. So if you put it in the chat, we'll voice that. We're gonna move on to Annie. Go ahead, Annie.
Okay, she's doing it.
She's gonna put it in the chat.
Okay. Okay, Miss Eleanor. Yeah, we can hear you. You're gonna put it in the chat for us.
Yeah, just write it in the chat because we cannot hear you. So put it in the chat and we'll take it forward from there. So go ahead, Annie.
Okay, thank you. Thank you, Chairman Gilmore. I just want to make a comment on the presentation and the use of words that was always mentioned in this presentation. And just to have that clarified, as for when we speak of sold to the developers, and when it came to the phase 1 and phase 2, I just wonder, are we making a distinction for a private entity as a family, a single family that would like to purchase a home, and not
Right,
just a developer, if it's a private entity, family, you know what I'm saying?
So I do. So two different things. So the first phase where we're selling units for $1, that is going to 501c3 nonprofit developers. These are developers who are nonprofits who do, housing, affordable housing development for a living. And, part of this is because I don't know if you've been in any of these units, but they're trashed. They're going to literally have to take them down to the studs and start over. And in some cases, they may even choose to bulldoze it down and just rebuild something on there. So the people that can do that are generally these developers. And the other thing that we wanted to make sure is that it wasn't being bought by this nonprofit developer who then bulldozes it and puts market rate housing, and then all of the folks that live in North Richmond that would potentially want to buy one of these are priced out of it because they start selling it at market rate. So the one thing that's going to happen with the nonprofit developers who buy these units for $1, they're going to then fix them up and turn around and sell them to anyone that wants to buy one of these units at a below market cost. In essence, they're not looking to make 100% return on their investment. They're looking to barely kind of cover costs and maybe make a little developer fee or some kind of profit involved. But the sales price is not going to be $600,000 per unit. Right now those duplexes are valued at $600,000. So when you start backing out all the improvements that happen to that, you start kind of seeing that, even on a private market sale, even though the value might be $600,000, you're only going to pay, $230,000 for it because there's $370,000 worth of improvements that need to be made. So then the question is, do you have $370,000 to go fix it up? And then you walk away with a duplex and maybe, rent out one side and live in the other, that kind of thing. So on the nonprofit side, that's the idea. On the market rate side, then that's where the individual families who are generally not 501c3s, can go and buy a property. And even, again, on the nonprofit side, even though they're getting it for $1 and they fix it up, remember, when all's said and done, they're going to turn around and sell that unit to somebody that lives in that neighborhood. They're going to be prioritized to be able to buy one of those units, and it's going to be at a reduced rate than what you would typically go walk down the street and buy the house next door for. So there are benefits to the families that live in North Richmond, not only through the nonprofit sales, but also when we start doing the market rate sales, because you're not going to be having to come up with $600,000 to buy these things. You're gonna buy it at an amount that then backs out the improvements that are needed. Okay, and again, that could be a big number when you start talking about construction costs on one of these one of these duplexes. I think that's the what you were asking, and whether a single family member, somebody who lives down the street wants to buy one of these, do they qualify as a 501c3? Generally, no, but they may be at 80% of area median income or below and want to buy one of those on the private market. And if they do, then they can do that. Remember, the units that the nonprofit developers are buying are going to be restricted to 80% of area median income households. The private market can be sold to anybody, and they can do anything to those units. You won't have a restrictive covenant on there, and the proceeds that the housing authority gets on those sales, we have to reinvest it in our public housing program. So what the plan is to take those proceeds and start talking about the redevelopment of maybe either the Rodeo property or the Pittsburgh property, El Pueblo. We'll find other properties to start reinvesting this money. It doesn't go into anybody's pocket to say, oh, well, let's pay ourselves back. Let's make all this money and pay bonuses to everybody. Nothing that we are earning in this process can legally be used for anything but reinvestment in affordable housing. So, you may have seen Princess asking a question earlier about, what happens with this money? Is it going to be just the developers getting whatever they want? And it's not. It was purchased originally with public funds, and it remains as public funds. If I didn't say I didn't have any more public housing to deal with, when I sold these properties, I'd have to give the proceeds to HUD. They're basically saying, hey, you got to pay us back for building these units back in the 30s and 40s. And if you don't do that, then we're going to sue you. So we say, oh no, we don't want to give it back to you, but we want to reinvest it in our public housing.
Okay, I see Pastor Jones has a question.
Let me just really quick, one thing I think I mentioned is that the developers that we're selling these $1 units to, there's a preference for local developers. So developers who already have relationships to North Richmond. So CHGC, for example, Richmond Land, they're going to be preferred over any developers who live, in New York or outside of the area. So we're really trying to keep it local. The developers are not, again, they're going to be nonprofit and local.
So Eleanor had a question that she expressed before about, agencies that may want to use the properties for certain particular programs and didn't know exactly where she fit in that model.
So the only place that's going to actually fit is going to be on the main campus. And again, whoever develops main campus could say, hey, we'll build a community center, but it's got to be over here, and that's fine. We can figure all of that out. But this particular process where we're selling these scattered sites, we heard back from HUD, and they're basically saying that, you can only do affordable housing on these sites. And that's why, Ms. Thompson was very, very excited about building a museum, and something that would honor Dr. Clark. And I still think that's a great idea, but it can't be in one of these scattered site properties.
So it can't be on the market sales as opposed to the $1 sales?
even on the market sales, again, the whole disposition contract, the agreement, we executed a disposition agreement with HUD. Anything that happens on these units has to be targeted to affordable housing. Now, one way to get around something like that, for example, would be like, you buy 3 or 4 lots, or units or dwellings or duplexes, and you bulldoze all that and you put an 8-plex on there, but on the ground floor it's a commercial kind of space like a museum or library or whatever else. So you actually are kind of backdooring it by actually having the affordable housing up here, but then having some sort of commercial on the ground. So you've met HUD's issue while still also taking advantage of your desire to have something like that on site.
So there will be a restriction then on the 24 homes based on it has to be for housing.
Yeah.
Okay.
Yeah. And remember, no matter what we do and how we sell and who buys, it all goes to HUD and we explain what's going on. So-and-so has submitted this application to buy these units. This is the proposal. This is the cost. This is the value. This is what the unit will be repurposed as. And they have to give our blessing. And once we get that blessing, then we can actually close on the deal. Without that blessing, there's not going to be a close. And that was specifically required in the Declaration of Restrictive Covenants that we executed on all the funds.
Great. I hope I represented Eleanor okay. If not, you probably hear some more from you're still breaking up.
Oh, you're breaking up still?
Well, wait, try again. Let's see. Go ahead.
Okay, I'm on my phone now.
Okay, we can hear you.
Excellent.
Okay, what I wanted to say is thank you, Mr. Gilmore, for speaking on my behalf. Tony, what I wanted to ask you, what if the duplexes on the corner of Fred Jackson Way and Market Street? Now, those are duplexes. What if I have housing in part of those units and resource center and museum in another part? Like there's two units. In one unit is housing, and in the other unit is a museum, and in the other unit is resource center, and then housing. Would that satisfy?
You would be able to do that on the private market sales. You're gonna have a restriction on the on the below market sales.
The below market sale, those are the dollar one that's going
Right.
for $1.
Right.
And what are the other options you said?
The market rate sales, again, the way that's going to work is we're going to say, hey, these are the addresses available. And because the nonprofits they get to pick the first go around, no matter who they are, they're going to say, hey, I want to develop these 4. Great. Then let's say we approve them, and HUD says, yep, you've got our blessing, go ahead and do this. Then we take those out of the mix. So at the end of that process, 28 of the 80 units will be no longer in play. The remaining units are going to be, listed as addresses that people are eligible to submit bids on. And as long as they're submitting a bid that's at market rate, then we're okay.
What is market rate, Don?
Well,
Tony.
an appraisal
What is
gets
market
an appraisal gets done, and whatever the appraisal comes back as, the value of that property, that's the market rate.
Okay.
Now, if the appraisal comes back and says it's worth $10, then that's your market rate.
Okay.
Okay, we got a lot of folks got their hands up. We're gonna move to Pastor
Okay,
Jones, who
thank
had
you.
his hands up for a while. Go ahead, Pastor.
Thank you, sir. So I just have a question about the process and how this is going. I haven't been around, and thank you, Mr. Gilmore, for your leadership, and thank you, Tony, for explaining that. I haven't been a part of the MAC, but I do want to ask a simple question. The simple question that I want to ask is that those have been families, and I thank you, Ms. Latifa, for that local buyer, because those were families and people that were displaced out of the Los Deltas. And I'm wondering, why do the developers have first right of refusal, so to speak, if I'm using real estate language, first right of refusal at first part of the property? So when those developers buy that piece of property for $1, they gain $599,000 worth of equity. Because you said, Tony, those houses are already worth $600,000. So we're selling developers $599,000 worth of equity already that could have gone back to some families. And then, so when you talk about affordable housing, what's affordable? When you talk about market rate, it's going to be affordable to those who can afford to purchase those homes. But however, if that $1 market rate was given to some persons that were locally, perhaps they can leverage that equity to get to rehab the house and do some quality work of a home. And then that person would be displaced out of their community.
Right. So
that's just an observation of what a young boy from Richmond have said, and one who walked those Los Deltas with families for about 7 years, helping those displaced families.
Well, you know, again, your math is generally correct, but remember, just because the value of that property is $600,000, it doesn't mean that you're going to buy it for $600,000 and move families in there. You're going to take that property and, you know, you're getting it for $1 because we already know you're going to have to put another $300,000 to $350,000 into that development.
Exactly.
Okay. And then when you do that, and you remember you're talking about a duplex, you can then turn around and sell that to 2 families that actually can afford to qualify for a loan. You know, the developer is not a lender. They're going to need you to go to a lender. They're going to need you to qualify for a loan. And if you're at 80% of AMI, you can only qualify for so much of a loan.
Exactly.
And you can only buy so much of a home. You will definitely not be able to buy a $600,000 home. I can tell you that at 80% of AMI. So this makes it actually more accessible for the families that live in that neighborhood that don't have that income to actually become homeowners. You know, there's been a lot of thought put into this. You know, yes, there are those folks who they don't want to deal with any of this stuff. They just want to buy the property, you know, do the work themselves, go be homeowners. We're going to have that opportunity. And again, all of what we're doing here is going to have first priority to the residents of Los Deltas that were displaced. And second priority is going to be the residents of North Richmond.
That's a great thing. That answers my question.
So it's literally kind of the whole purpose of our efforts here was to kind of build wealth for the families that live at we're living at Los Deltas or live in North Richmond. It's been our motive from the very beginning. You know, you talk to our executive director, Joseph Villarreal, used to be on the board of CHDC. He's very committed to make sure that this effort builds wealth for the families of North Richmond. Because yes, we could turn around and sell it to a developer tomorrow. They'll come in, bulldoze everything, build, you know, $800,000 homes, price everybody out of the market. That was not our intention from the beginning. It hasn't been our motivation to get everything done. We're trying to keep things at a level that is going to result in affordable housing for the families that live there. And you know, we can say what we want. At the end of the day, all of this stuff costs money. And as much as I want it to be cheap, it's going to cost something, right?
No, that's great. And that's my concern, is to make sure that when developers do release that property back to the community, that it is affordable.
That's the hope, yes. And again, you know, if they're on a mandate in this process to sell to only families that are 80% of the area median income or below, they won't have much of a choice as what that price is going to be. Because if, say, they set that price at, you know, $600,000, and a family at 80% of AMI can only afford $400,000, Well, now they have to go back and look at how much money they spent to do all this rehab and decide whether, you know, they can live with a $50 profit instead of a $100,000 profit. You know, because at the end of the day, if they don't do what they're contractually going to oblige themselves to, we're going to take those units back. There's going to be language in the contract that says, if you mess this up, I'm taking it back, and then I go out and market it.
Now that's comforting to know. I'm gonna shut up and go and let you guys finish the business.
Yeah, just to reiterate, like developers will be mandated to sell it as affordable, and they have to give priority to Los Deltas residents first and North Richmond residents second, before it goes on the market to anyone else.
Okay, Cynthia had a question. Go ahead.
Yes, Tony, my question is, you have all these rules and regulations as far as buying the property. And what if the buyer defaults on the contract? Does the property go back to Housing Authority and you resell it again, or what?
No, so remember, there's two tiers here, right? So for example, with a nonprofit developer, they're going to buy, you know, up to 5 buildings for $1 each. And then they in turn fix it up and they become the owner that sells to the residents in the North Richmond area. Now, if one of those buyers defaults, the property goes back to the nonprofit developer. Because at that point, we're out of the ownership structure.
Okay, I got
except
you on that one.
for the 20-year restrictive covenant. You know, there's a legality in there that says, hey, you can't turn around, buy this or sell this to a family at 80% of AMI, and in 2 years, turn around and sell it to somebody that's at 150% of AMI, and then they raise the price. It's going to have to stay at that 80% of AMI for 20 years.
Mhm.
You know, and that number keeps going up, but it's still 80% of area median income. Now, what happens if the nonprofit developer defaults? They don't follow through on their purchase agreement where they're going to put the units aside for, you know, families at 80% of AMI. Well, now they're in default of the sales agreement that they're going to sign with us. We take the property back. And I don't necessarily want their property back, but we will, and then we'll remarket those units. You know, there's got to be some level of supervision in this process. And as much as we don't want to be, you know, policing this process, you know, and I don't expect our nonprofit partners that end up buying these units to be those people. You know, I expect them to honor their mission, which is being a nonprofit housing developer, make a housing affordable to, you know, low-income families. That's literally what they do for a living. So when they start going awry of that, they've got bigger problems. The private market purchasers, you know, if they default, they're going back to the bank.
Right.
You know, just like any real estate transaction. You know, it's just a standard real estate transaction at that point. You know, we're going to be out, they're going to be in, and that's the end of that.
And so, Tony, I just want to put this out there. It's something I come to realize that the Housing Authority have expenses on that property, even though it sits vacant with no house or anything like that. There's a large amount of expense being paid out on that property for security and various things.
You're absolutely right. And, you know, when I was telling you about, you know, the proceeds of our market rate sales going into further development, that includes reimbursing ourselves for some of these costs that are happening. You know, some of the costs that you see happening, like, you know, the fencing, HUD has given us the funding for that. We get funding for up to 2 years after a property like this closes. But that time is coming up real quick. And then it's like, well, now how do we pay for all this? Well, that's going to have to come out of our pockets. And that's, you know, there's definitely kind of motivation on everybody's part to make this happen and get it done.
All right, thank you so much, both of you, for the presentation. And I'm sure if you want to contact with follow-up questions, they can contact the Housing Authority and they can follow up with them. So thank you very much. We're going to move on because we are late in the day, and we'll move to item number C, Resilient Hub at Shields Reed, and whoever's there to make that presentation, please go right ahead.
Yes, thank you very much. Oh, hey, cut that second volume over there. All right. Good evening, everybody. Thank you very much. My name is Chris Santiago. I'm with Rebuilding Together East Bay North, and we would like to present to you a brief presentation on the resilience hubs that are intended to come to Shields Reed Park.
Let me just ask for
I'm gonna go ahead and
clarification.
jump on
Let me just ask for clarification.
quick
Is
screen
this,
share
is
here.
this, let me see. Can you hear me? Chris, can you hear me? Is this the same presentation
Okay.
that we saw before? We did see one at the last meeting. In the interest of folks' time, I want to be sure is this different from the one we got before?
Okay, so I would like to start by saying we introduced this briefly, or presented briefly, I should say, a couple weeks back at the last meeting. And we realized people were a little bit taken aback by it. It had been quite some time since this project was written in the grant phase. You know, it was early when COVID was really first onsetting that the grants got written by us in partnership with Stephanie Nye, Jean Levine Snipes, City of Richmond, through PG&E. So it's been quite a while. So we realized that we needed to present in a little bit more detail. There was a couple of comments that were made about the shipping containers, and just a quick briefing. Let me see if I can do this. I'd actually like to show this slide first, if I can. My mouse is not working. Hopefully this is going to give everybody a clear enough shot. But this is the Resilience Hub. And if I can scroll down without the use of my mouse here. These bottom bullet points are basically stating what the functionality is for these resilience hubs. So they're designed to provide a solar battery bank where people can charge their devices. They also have misting shade coverage. You know, hot days is really one of the primary uses for these when it's really hot outside and, you know, people are at the park and running around and it, you know, they can get shade under the covering. They can get mist and water. They can charge their devices, things like that. And so that's kind of the functionality of it. Now, there was a couple of comments that were made from community members that thought they looked kind of funny, or they, you know, weren't the most attractive thing, being that they're made out of shipping containers. So I understand that, you know, for somebody that's never seen this concept, it could seem a little bit strange. So we wanted to take you through a little bit of more information on how we came to the idea of using shipping containers. And so in order to do that, we have some slides over here that kind of demonstrate how we got the idea and how shipping containers are being used across the world for many different purposes. So jumping right into it, you can see that these shipping container complexes are actually being used all across the world. You know, they're in London, Los Angeles, New Zealand, Dallas, Korea, Detroit, Las Vegas, Kansas, Buenos Aires, and that's just to name a few for many different uses. For example, this is one in South Korea where a shopping complex has built. I don't think I have a slide showing the back of this place, but it's a wide open, you know, dining, seating, stairs up and down, shopping, stores, all kinds of stuff happening in there. This is another one in Detroit where they're used a little bit differently. You see they have a little bit of a different aesthetic. Here's one in Nepal. You know, complete shipping container complex, restaurants, outdoor seating. Here's one in Africa. You can see that they have a unique spin on the aesthetic, different design work. And now I wanted to show some individual container use cases. So that these are, boxes used in individual ways, all kinds of things. You see these things being used, coffee shops, vending stations, food stops, all kinds of different stuff. And you can see this one has just a very simple color scheme, solid color, looks very clean. Here's another one being used a little bit differently. Pretty nice patio cover they have installed, and you can see the different color usages. Here's another one that looks like a food stand. And you can see they're pretty clean looking. You can put kind of any design you want on there, and they really come out pretty nice. Here's another one that has a really simple look, one color. Actually kind of resembles the build that we were intending pretty closely with that patio cover. And then here are some containers that have more creative art designs on there. In the last meeting, we mentioned that we actually provided a kind of a flyer that had a call to action on it, stating that we were looking for community artists, to be involved in the project. So kind of providing multiple options. It could be a simple color, or it could actually have a full-blown design on it. So here's one with a really cool art piece. Here's the entire thing, and you can kind of see a gentleman working on the piece, putting some final touches on there. So looks pretty nice. Here's another one with a more simple color scheme, two color scheme, and you can see you can make them look pretty clean without doing too much. Here's another one with a really nice design on it. This one is kind of in line with kind of what we're doing. We have solar power on the box, and a nice energy efficient system that we have happening. Here's another one, really, really artful, really talented designers that put their touches on this one. And then here's another one. Pretty nice design here. You can see from this side, really nice bird imagery. And then if I was to be able to kind of spin this box over, you would see that there's, a ladybug, a raccoon. A better shot of that shows that it was really nice work done on that one. So call to action, looking for artists and muralists. So we did and would like to continue to kind of broadcast that we are hoping to recruit a designer, painter, muralist to do a piece. If we could find one, that would be really great. So if anybody in the community knows anybody that they can request, for art services, that'd be really great. There is a $500 artist stipend. And then all supplies will be paid for by us, Rebuilding Together East Bay Network. That's a little bit of a sneak peek. We actually have a name change coming, but not to go into that. For more information, contact myself, Chris Santiago, and I can be reached by my email here at chris@rtebn.org to field any questions and to work with the artist if we do find one. So moving along.
Well, I think this may be a good place. Can you hear me, Chris? Can you hear me?
So
Hey,
There
Robert,
was
I
a
don't think you can
question
hear me.
about,
Can you do
I
something?
can hear you, Don.
I'm sorry, I think
there was a
Chris
question about the
probably turned
location
down his volume because of the echo.
of
Chris,
the,
can you hear me? I'll send Chris a
shipping
direct
container.
message. Sorry
There was a
about that.
question of whether it could be put at another location. And
I think we need
request that
to
we actually
table
look at
this
that
right now
site,
because there's,
Lucky A's ball field,
and I don't know how
as
to
they
do that
call
with
it.
Chris.
And we
Oh, yeah, the
did
chat would be good.
check into that. And
Would you like
I
me to
personally
mute him
spoke
now?
with Mark. I can't pronounce his last name.
Was that Robert?
Okay, I've muted Chris.
Okay, thank you.
Yep.
So look, I think what we asked about was the relationship of this project and how it looked in relationship to what's already there. And I think that the aesthetics of it, we saw what was done in some other sites and looked like a lot of planning went into it to get something that complemented the community. I don't know that that they've heard us in that regard. So I would like for us to maybe, you know, if they can, we can do a smaller setting with Chris and them and talk about some of the things that we would like to see there that would be aesthetically more pleasing to what we saw before. And if that, I'm recommending that to the board for suggestions, then come back again and let's see what we have. So Annie, your hand's up.
Thank you, Chairman Gilmore. Just quickly, because I'm going to have to sign off. But I just sent some comments over to you because I didn't think that I would get a chance to have a break. But if we can, it's two things to extend. I'd like to make a motion to extend more time if you would like, if that's the pleasure of the board. And then the other thing, if you could share my my comments, or if we can, or forward over for our for this presentation to come back and be the first thing of presentation at our next meeting. So I just wanted to say that I'm going to have to get off, but I do, it's just those two things. If you were extending the time, because we are at the essence of 7 o'clock, and for those comments for you to mention.
Let's take them one at a time. So the first is for the extension of time to, is that 15 minutes? Of time extension, Annie?
Yes, but I won't be able to participate because
I understand. I understand.
Yes.
Is there a second for that? To extend to 7:15?
I second the motion to extend the meeting till 7:15.
All in favor are here by saying aye.
Aye.
Oppose? Abstentions? I take that as unanimous. So your second motion was to, would you go ahead and state that, Annie?
Yes, my second motion was, I know I'm going to get off, but it was the design, design and the conversation that was taken upon the design the last time this was presented at the MAC, and how it looks and how boxed it is and its location. The other thing is the design to have a master artist as myself, but I'm too old now, but a master artist to come and to be very tasteful. If they do design on the front of the facade of these boxes, to be very tasteful and not to look like tagging. That's what I wanted to mention at this point. You know, we see a lot of tagging up and down the freeways and on buildings and stuff, not to bring that into the forum, but to have something more tasteful and more professional of exquisiteness.
So if we can, if your motion is to maybe extend this to the next MAC meeting for further conversation.
And to kind of put it on the first end, because
so we can have time to go through it.
Yes.
Okay, and is there a second for that motion?
I guess it died. I guess not.
I can second the motion, Annie.
Okay, Princess
Okay.
seconds. All in favor, I know you by saying aye.
Okay, aye.
Oppose?
Aye.
Opposes? Anybody oppose? Abstentions? Okay, motion carries.
Okay.
So I don't know if Chris can hear me, but we're going to ask him to come back. I would encourage him to reach out to, if you're available for us to have a couple of MAC members work directly with you before you come back. I think that would be good. If anybody, any of the MAC members want to volunteer, let us know.
Okay.
All right, thank you. We're going to move on to the
Thank
next item. Okay, we're going to move on to agency reports. The City of Richmond Community Service Department. Anybody here from there?
I'm here.
Thank you.
Hi, thanks, everybody. I'm going to make this quick. Just wanted to let you all know that the North Richmond Mobile Tool Library, we're open now to sign up residents of North Richmond, along with any nonprofits that do beautification projects within North Richmond. We're a tool lending library, and we show up on the first and the third Saturdays of each month, right across the street from the health center, like kitty corner from the health center that was shown earlier. So we're at Fred Jackson Way and Gertrude Avenue. I'm going to put my phone number in the chat. If you have any questions about the mobile tool library, please feel free to call me. Thanks.
Thank you, Jessica. We're going to move on to Shields Reed Neighborhood Council. Anyone from Shields Reed Neighborhood Council? I don't see anybody stepping forward. And we had the Housing Authority. I don't think there's anything else that you would like to add right now, or is it? For Robert or Hannah? Nope. Okay. And we'll go to Supervisor. Robert.
Thank you, Don. Yeah,
Yep.
appreciate that very much. Robert Rogers, Supervisor Joya's office. Hi, everyone. Great to see this good participation for this meeting. Those were some really informative presentations. I hope we all were listening very closely, especially the health clinic in Las Deltas. Really impactful stuff and moving forward in a good community engaged way in North Richmond. So that's all great to hear. I will be here for the next several months, filling in for Tanya, who's having her baby. We're all very excited about that. And please, if you need my phone number, my email, just reach out anytime. I'll put it in the chat as well. I will share just briefly that we took a walk, Supervisor Joya and I, with many residents and leaders, some of you here in this meeting now, around the community in the evening last week to look at lights. And we're gathering more and more information to think about how we can work with PG&E to enhance lighting in the community. That was really my first foray back in, stepping in for Tanya. She just went on leave this week. And I'm at your service. And Supervisor Joya, of course, always is. Thanks very much. End report.
Thanks, Robert. We're going to move on to CHDC mitigation. I don't know if that's Daryl or Victor or.
I believe Janine should be on the
Janine.
call.
Okay.
It's me. I'm sorry, I couldn't get the thing. Thank you, Chairman Gilmore. Just real quickly for Victor, the March newsletters will be, the March newsletters will be delivered in March. The resource team walked will be on Thursday with Supervisor Joya along the Wildcat Creek. And we will have two baseball teams representing North Richmond, which will be Verde and Shields Reed Park. And then for my mitigation report, we had a meeting with the county and the Richmond Sanitary Services hotspot crew, and it was very, very successful. They have increased the amount of garbage that they are, trash that they're picking up. It's great to have the deputy working with us alongside. It's just all very positive and going very well. I attended the Light Up North Richmond walk with county supervisor, and it was really, you never think about it, but only one side of the street has lights. So I think it's going to be a really successful project. I attended the North Richmond Mobile Tool Grand Opening, and it was just a huge success. So the Senior Center is doing
doing well. Our line dancing team class will actually be performing for Black History Month. So that's all I have to report. Thank you.
Thank you. We're gonna move on to Richmond Land. Anyone here from Richmond Land? All right, we're gonna move over to Cooperation Richmond.
Hello, Princess Robinson here, project manager for Cooperation Richmond, located in the downtown area. Just want to announce that right now we're still accepting project intake. So we serve West County residents with technical assistance to cooperatively organize to develop and launch cooperative businesses. We are currently about to launch a cooperative cost-based level 8, a Black women Richmond native worker-owned party equipment rental business. And if you could follow our Facebook to get more updates on that. We're also incubating a small worker-owned grocery store in low-income neighborhoods like downtown Richmond or North Richmond. And we are also developing a cannabis retail cooperative with Black Native men from Richmond who have been criminalized for cannabis in their past. And then our long-standing worker-owned bike shop in downtown Richmond who are currently recruiting members, worker owners for. So we do have projects that currently folks can join as worker owned or apply as a worker owner, or you can develop your own by filling out our project intake form on our website, which I will put in our chat, or you can just email me to navigate any of our processes.
Thank you, Princess. Let's go to Urban Tilt.
Hey there.
Yep,
Okay.
there we go.
All right, so let's see if I can do a quick summary here. So our CSA has resumed. You know, we had the break from December, late December through January. So CSA is back, so you can have fresh produce delivered to your door. Also, Free Farm Stand is back every Thursday at 2 o'clock on Fred Jackson Way, right by McLaughlin, the McLaughlin parking lot. We had some volunteers come out last month. So they planned it in the newly constructed rain gardens on Fred Jackson Way. And let's see, so that was, have volunteers come out. That's headed by the watershed team. Let's see, and so the official opening for the rain gardens is March 25th. We've had a couple of date changes, but the official opening is March 25th. That will be our Local Heroes and Rain Gardens event. Is a celebration of community and legacy. So we not only will we be honoring Princess Robinson, Miss Annie King Meredith, and Janine Shahid, but we'll also be honoring Fred Jackson, Dr. Henry Clark, Whitney Dotson, and Mike Carlson. If anyone, I would really like to know if there's a relative, a local relative of Mr. Dotson. So if anyone has information on that information, that would be great. As I mentioned last time, the farm, the construction is going to be starting in April. We have the 5-phase construction project. So keep your ears open for hiring. We'll be, we're including local hires for the construction, including construction apprentices. Also, if you're a licensed subcontractor or you want a licensed subcontractor to get the bid notice, you can email me, contact me. We're still looking for a couple of seats on the Community Advisory Committee. We are looking right now, we have a couple of seats for Latino, for the Latin community, Southeast Asian, and Ohlone community, and also for like, if you're a CSA member, we're still looking for those seats. And I think, I think that's it. I think that's it. I think we included everything in the email that Tanya sent out. So thank you very much. I appreciate it.
Thank you. And there's some information in the chat on for Whitney Dotson's relatives.
Oh, thank you. Thank you very much.
Okay, look, folks, thank you for your patience and your indulgence and your participation in this meeting. We will officially adjourn at 7:10 and we are adjourned. Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Bye, everyone.
Thank
Thank
you.
you.
Good
Good
night.
night.